Today, we're going to dive deep into the topic of upper back pain related to the lungs. In this video, we'll explore the symptoms, causes, and treatment options for this type of pain in detail. We'll also discuss how this pain can affect your quality of life and ways to manage it effectively. By the end of this video, you'll have a better understanding of what this pain means and how it can be controlled. The connection between upper back pain and the lungs. Before we begin, it's important to understand how upper back pain can be connected to the lungs. Our lungs are vital organs located within the chest cavity, responsible for our breathing function. Any issue in the lungs can cause pain that radiates through the chest and reaches the upper back. This pain often becomes more noticeable during actions like deep breathing, coughing, or sneezing. Symptoms and warnings. Recognizing the symptoms of lung-related upper back pain is crucial for accurate diagnosis and treatment. These symptoms are usually prominent, but sometimes they can be mistaken for other health issues. Here are the most common symptoms of this pain. Sharp and deep pain. The pain felt in the upper back is usually sharp and deep. It may become more intense during breathing and can sometimes be unbearable. Shortness of breath. This type of pain is often accompanied by difficulty in breathing, known as shortness of breath. This condition is caused by an issue in the lungs and may require immediate medical attention. Coughing and wheezing. Persistent. Coughing and wheezing often accompany upper back pain. If the pain intensifies during coughing, it may indicate a connection to the lungs. Fever and chills. If your upper back pain is accompanied by fever and chills, it could be a sign of a lung infection. These symptoms may indicate a serious condition like pneumonia. Causes of upper back pain. There can be various causes of upper back pain related to the lungs. Understanding these causes in detail is critical for identifying the source of the pain. Pleurisy, pleuritis. The pleura is a thin membrane surrounding the lungs. When the pleura becomes inflamed, it is known as pleurisy. Pleurisy often causes sharp pain in the chest cavity and the upper back. This pain intensifies especially during breathing or coughing. The primary causes of pleurisy include infections, autoimmune diseases like rheumatoid arthritis, and lung cancer. Pulmonary embolism. A pulmonary embolism occurs when a blood clot blocks an artery in the lungs. This condition can lead to sudden and sharp chest pain, shortness of breath, and intense pain in the upper back. Pulmonary embolism is a life-threatening condition that requires emergency medical attention. Risk factors include prolonged immobility, post-surgical complications, and certain hereditary clotting disorders. Lung cancer. Lung cancer often leads to the formation of a tumor in the lungs. This tumor can press against surrounding nerves, causing severe pain in the upper back. Other symptoms of lung cancer include persistent coughing, blood in the sputum, weight loss, and fatigue. Early diagnosis and treatment are crucial in cases of lung cancer. Pneumonia. Pneumonia is an infection that causes inflammation in the lungs. This condition is usually accompanied by fever, cough, and sputum. Pneumonia can cause pain in the upper back, especially when the infection affects the pleura. If left untreated, pneumonia can lead to serious complications, making early treatment essential. Pneumothorax. Pneumothorax occurs when the air sac around the lungs ruptures, leading to a collapsed lung. This condition usually presents with sudden chest pain and upper back pain. Pneumothorax makes breathing difficult and requires urgent medical intervention. Tuberculosis. Tuberculosis, TB, is a bacterial infection of the lungs that can cause a chronic cough, sputum, and upper back pain. TB often affects the upper regions of the lungs, leading to back pain. This disease remains prevalent worldwide and can be fatal if not treated properly. Diagnosis and diagnostic methods. Accurately diagnosing lung-related upper back pain is essential for effective treatment. To determine the cause of the pain, your doctor may use the following methods. Medical history. Your doctor will evaluate your medical history and current symptoms. They may ask about smoking history, previous lung diseases, or similar health issues in your family. Physical examination. During the physical exam, your doctor will assess the location of your back pain by palpating or applying light pressure on your back. They will also listen to your lung sounds using a stethoscope. Imaging tests. Chest X-ray. A chest X-ray is a common imaging test used to detect abnormalities or infections in the lungs. CT scan, computed tomography. A CT scan provides a more detailed image of the lungs to detect tumors, embolism, or other abnormalities. MRI, magnetic resonance. Imaging. MRI is a high-resolution imaging method used to examine lung tissue and surrounding structures. Blood tests. Blood tests are used to detect infections, inflammation, or other abnormalities in the body. Treatment methods. The treatment of upper back pain depends on the underlying cause of the pain. Here are some common treatment methods for this type of pain. Medication, antibiotics. Antibiotics are used to treat bacterial infections such as pneumonia or pleurisy. The correct medication and dosage are determined by your doctor. Anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, NSAIDs, can be used to reduce inflammation and relieve pain. Blood thinners. In cases like pulmonary embolism, blood-thinning medications may be prescribed to dissolve blood clots. Physical therapy. Physical therapy can help strengthen the upper back muscles, increase flexibility, and correct posture. Physical therapists can develop exercise programs tailored to your needs. Surgical intervention, tumor removal. If the cause of the upper back pain is lung cancer or a large tumor, surgical intervention may be necessary. In this case, the tumor is surgically removed or cancerous tissues are excised. Surgical intervention is often combined with chemotherapy or radiotherapy. Pneumothorax repair. In cases like pneumothorax, a surgical procedure may be required to allow the lungs to re-expand. During this procedure, the collapsed lung is reinflated and the air leak is sealed. Pulmonary embolism surgery. In the case of a pulmonary embolism, the clot may need to be surgically removed, especially if it is large and dangerous. Respiratory therapy. Oxygen therapy. Oxygen therapy may be required in cases of shortness of breath or weakened lung function. This therapy helps the lungs work better and provides the body with the oxygen it needs. Breathing exercises. Breathing exercises prescribed by respiratory therapists are important for increasing lung capacity and strengthening respiratory muscles. These exercises can help alleviate pain in conditions like pleurisy or pneumonia. Lifestyle changes. Quitting. Smoking. Smoking is one of the biggest risk factors for lung diseases. Quitting smoking not only improves lung health, but also helps reduce back pain. Healthy diet. Adopting a balanced diet is important for keeping your immune system strong and protecting your lungs. Foods rich in antioxidants, such as fruits and vegetables, are beneficial for lung health. Regular exercise. Regular physical activity improves lung function and strengthens back muscles. However, be careful not to overdo it and follow the exercises recommended by your doctor. Home remedies. There are also some home remedies you can try to alleviate upper back pain. These methods are supportive of treatment and can help reduce the severity of the pain. Hot or cold. Compress. Applying a hot compress to the painful area can help relax the muscles and reduce pain. A cold compress, on the other hand, reduces inflammation and relieves pain. Talk to your doctor to determine which method is best for you. Pillow-supported sleep. Placing a pillow under your back or beneath your shoulders before sleeping can help maintain the natural alignment of your spine and reduce back pain. Additionally, sleeping on your side can help relax your lungs and reduce back pain. Posture. Correction. Poor posture can increase upper back pain. Pay attention to correcting your posture while sitting or standing in daily life. You can achieve proper posture by pulling your shoulders back slightly and pushing your chest forward. This posture relaxes your lungs and reduces back pain. Breathing exercises. Deep breathing exercises increase lung capacity and strengthen your lungs. Taking a few minutes each day to practice deep breathing can support lung health and help alleviate pain. Upper back pain is a common issue that many people may experience, and when related to the lungs, it's a condition that should be taken seriously. This type of pain can be a symptom of various lung-related diseases. Therefore, if you experience upper back pain along with symptoms like shortness of breath, coughing, or fever, it's important to consult a doctor. Early diagnosis and proper treatment play a critical role in managing this type of pain. Don't ignore the symptoms and take the necessary steps to protect your health and improve your quality of life. Remember, when your lungs are healthy, your quality of life improves. With the information shared in this video, you can better understand upper back pain and make more informed decisions on how to manage it.